Hello, and welcome back to the In Between podcast. I am interviewing Dr. Jade. Dr. Jade is a board-certified family medicine physician and the founder of NSPIRE Primary Care here in Las Vegas. And I've seen her speak a few different times and I've binged her content. She is incredible. She's changing the way that primary medicine operates, and she's taken the membership model and taken it even further. And I'm just so excited for you guys to understand healthcare, because I don't know about you, but for me, it's so freaking confusing. I've spent so much time trying to find insurance, trying to find the right doctors, and she's kind of sold me. So I might be using her services soon. I love Dr. Jade because she is so freaking smart. She is someone that I emulate as a woman in business, and she's making a difference. She's focused on long-term health instead of just reacting to medicine when something is going wrong. She emulates what you should want to be for health. She takes care of herself, she's active, and she's grounded in values. And I don't know why you wouldn't want to go to a doctor who has all of those things. So it's a really great conversation. Let's get into it. Welcome to the In Between podcast. I'm your host, Cassidy Owen, and I'm the founder of Cassidy Lynn Social, a social media management agency dedicated to helping brands find their authentic voice online. But more importantly, I'm someone who believes that the real magic happens in the messy middle, the in-between moments that shape who we become. Every week, I sit down with female founders, entrepreneurs, and incredible humans who are navigating growth, failure, and everything in between. So grab a nice coffee, get comfortable, and let's dive into today's conversation. Today, I am so excited to welcome Dr. Jade to the In Between podcast. I have been blessed to hear Dr. Jade speak on why she's so passionate about healthcare and really just human care is what I'll call it. So Dr. Jade, welcome to the podcast. I would love to start out with you introducing my audience to who you are and the impact you're making.
Thank you so much for having me. I appreciate it. So yes, I am Dr. Jade Norris. I go by Dr. Jade. I'm from Las Vegas. This is my hometown. Growing up, I knew at 4 years old that I wanted to be a doctor. But as I grew through the city of Vegas, high school, middle school, all the things, I just realized how it was so difficult to find quality healthcare. It was difficult to find a doctor when I needed one, although that was what I wanted to be. And so it became my mission pretty young to finish my training and come back to my hometown and provide really high quality care to my home community. And so our practice, NSPIRE Primary Care, is our private practice. We've been open 4 years, and it's just been such a blessing to serve my hometown with quality health care. And so it's like my childhood dream come true. So I feel really, really blessed.
I love it. You're doing all the right things and doing it, what I would say, like a woman, which is the best part of what I watch you do. Is there a moment in your journey, even from young, when you were a kid and this was your dream, that you realized that you wanted to have a practice that served people differently?
Yeah, that's a really good question. My first exposure to medicine, so I was born in Chicago and I had a pediatrician there who had a private practice, and it was a male physician. So my first exposure to being like what a doctor is was a male private practice doctor, and he just treated me like so well. He would answer all my questions because I thought it was my time to quiz him on like what it's like to be a doctor. And I just remember him just being warm and feeling like family. And he had his own business. So that was my exposure. And then once we moved at 8 years old to Vegas. That's my hometown. And so high school, that's when you have to start finding mentors to shadow. And my OB-GYN let me shadow at her private practice. So again, it was like private practice. She's going room to room. Her patients know her. So all of that was like what I wanted was relationship. I wanted people to feel like it was just a doctor in the family, and that was how they made me feel. And then the actual flip side of that was going through residency training and actually learning what the business of medicine has transitioned into in our country, where it is the complete opposite. It's transactional. It's about collecting copays. It's about rushing people in and out. It's about a conveyor belt experience. It's about maximizing the amount of cash flow for the insurance company, even at the risk of decreasing quality of care for the patient. And so it was the complete opposite of my dream and what I had experienced experienced, at a younger age. And so I learned pretty early on that private practice was going to have to be what I did. And I was blessed to find out about a model of primary care called direct primary care while I was in residency training. And so I knew pretty early on in my training that that's the type of practice I was going to start straight from residency.
Yeah, that's so powerful. I remember when I heard you speak at Take the Lead and everyone's eyes were like so wide hearing this different form of medicine. I think especially in the Las Vegas Valley, like it's a disaster is how I would call it. But to be doing something differently and shifting the culture starting in your hometown, I feel like that's such a cool experience. Obviously, there's this different layer of healthcare, but when I see you, and this is my perception, I'm not a patient, but when I see you online, like I feel like you're taking it even further and really modernizing your practice and what you do between social media, even just your website and different community events and things like that. What's the passion behind that side of it?
Well, I'm a person of faith, and I really listen to what God tells me to do if I'm just being the most transparent I can be. When I speak and things like that, and I speak at a lot of medical conferences, people will ask me, okay, well, what made you, launch a women's pickleball group? What made you do this or do that? My husband and I, we have a nonprofit branch of our practice. And so we do a lot of philanthropic events in the community. We do a marriage event in the community. And people will ask like, well, what made you do that? Was it to grow your practice? And the truth is, it's like, those things led to feeding into a healthy business, but it was truly me doing what God told me to do. And thankfully, it was things that I naturally love doing anyway. Like I love pickleball. So having a women's, Lady Leaders Pickleball group, which is the nonprofit side of our practice, and meeting with women and playing pickleball and like having wellness and networking and all of that. That's like naturally what I would have wanted to do anyway. So when you ask like what made me want to do things differently, I really just believe it's like listening to God and saying yes to the things that prompted to do out of things that are already in my calling, instead of trying to like see what other people are doing and be like, oh, well, let me try that. I really had to say, you know what? You are really good on stage. You love social media. You love to create content. And that might not be how other doctors are called to grow their practices, but this is how you're called to serve for yours. So yeah, really focusing on my lane and focusing on my path.
I love that answer because I don't think anything monumental has happened by following the lead of someone else, right? The greatest impact is when you hear that voice and you follow that calling, and that's how you truly make a difference.
Yeah. And it's scary, right? Because it's easier if you like you do something everyone else has done and exactly how everyone else has done it. It's like, man, that would just be easy if that would just work for me too. But being okay with if your journey looks different and innovative.
You've obviously built so many different legs to your business, from the nonprofit and the different community aspects. And just going to medical school and taking those risks. And on top of that, you have a beautiful family.
Thank you.
What do you feel through all of this was maybe the most challenging or most in between, we could say, moment that you had to power through in order to get to the side that you're on now?
What's so interesting is every season has had both aspects, right? Like people see what they see visually, but every season has challenges and every season has blessings. I can't say there's any one season that just has like, oh, it's just all 4 cylinders, all channels are just killing it, right? There's always a blend of both happening. So like as a child, I tell the story all the time of like, at 4 years old, God showed me I was supposed to be a doctor. But on the flip side, the first time I said I wanted to be a doctor out loud, which was preschool career day, the first response out of my preschool teacher's mouth was, you need to think about something else, consider something else, because she saw a brown girl in Chicago whose family, there was no doctors in my family. And her ceiling for me was think of something more realistic, right? And so you can have both happening at the same time. And I could give examples of that in every season, right? I've had so many people tell me along my journey to think of something else, that I wasn't called to medicine. I didn't look like a doctor. I didn't come from doctors. My colleagues would be like, well, are your parents doctors? Like, how did you get here? Oh, was it affirmative action? It wasn't that I was just enough. And so I had to just still know it, regardless if people believed it or not. I'm young with a business, right? And I have employees now. And now we are in this other season, and being able to walk into rooms and just be confident in who I am. Every season, there's both things happening, and it's just knowing who you are and still being able to show up and serve. And you're not called to everybody. So there's some people I'm able to serve, and they love it. It clicks for them. And then there's other people I'm not called to serve. And that's okay too.
I love that. I love it. And I love that you have such strong faith and belief in yourself that even at 4 years old at preschool, when someone's telling you that might not work out, you're constantly proving her wrong on so many different levels.
Yeah, absolutely. And I needed that. What's so funny is I struggled through my training because my mind didn't blend well with just traditional standardized testing. Put me into a room, have me explain it, write it on a whiteboard, go see a patient, perfect, right? But then you put me in front of an 8-hour test where I'm just marking A, B, C, D. For like, my brain just didn't like that. But that's what you have to do to be a doctor. You have to sit and take lots of 8-hour standardized tests over and over and over. And so I struggled with that aspect. And that's why people told me, like, well, you're not going to be able to be a doctor if you can't take tests well. And I just had to know, like, okay, just push through this, like, focus on this season. And it does eventually work out one way or the other, but for your good. So
did you, or do you currently still struggle with that imposter syndrome of the words, not only that you just heard when you were 4 years old, but throughout your life and business and career? Because I would imagine that's not something that, as strong as we are, we can just be like, no, I'm going to keep going. How do you fight that battle?
Yeah, I no longer look at it as imposter syndrome as I did when I was in training originally. So when I was in training originally, I would be maybe 3 Black people in a class with predominantly white men who didn't think I belonged there. You know, a class of 200 people. And I went to school in a more rural area with Confederate flags, and where it just culturally, I'd go on a service and there would be, 2 to 3 people where it'd be like, they don't want to see a Black person on their healthcare team. And I'd have to skip over rooms, like, this is still happening. And so that was a season where I could definitely say I had imposter syndrome I had to get over, like being confident in my skin, being confident in being a woman in a male-dominated field, speaking up, being okay to not know something without feeling like, oh, well, that means you don't belong. So I would say back in that season, I had to get over a lot of more imposter syndrome. In this season, I've matured out of that, but every season now, it's pushing, it's stretching. And every season where I'm being stretched, like, for example, we recently underwent an expansion in our business. We hired a nurse practitioner to our practice. We expanded to a second suite. I don't have formal training on how to hire people, how to set up payroll, workman's comp, how to create benefits packages, how to interview people, how to train people, right? And so that stretched me. It was uncomfortable, but we did it. God blessed us to do it really well. And now I'm being stretched to expand my business from a Las Vegas-based business, which was my dream, was to just care for my hometown well. And now we're being called to expand to other states. And we're in the process of expanding via telehealth to it becoming a national business. And now that's scary and that's a stretch. And I haven't done that before. So it doesn't stop. But to answer your question on what I do, I let myself be okay with the discomfort. If I need to cry, if I need to have a mental health day or week, I definitely am going to go to the gym, pour into my, lifestyle, healthy lifestyle, things that fill my cup, be around people intentionally that fill my cup and are truly encouraging me, not surrounding myself with people who think small, only surrounding myself with people who think whatever they're going to say, most people would think they're crazy because that's how they naturally think. Like, they're looking to buy islands. They're looking to, provide water to Africa. The way they think is massive, and it helps me to think bigger and believe I can do it too. So all of that, it doesn't stop being scary. And my family, my husband is incredible. My family is incredible. When I'm low, they lift me up. Prayer, God, number one, my faith life. So all of that, spending time with my family, my children. Yeah, I just have to be intentional about those things.
I love that you listed all the different aspects, because I think sometimes we get caught up in one thing, especially with social media, like, oh, make this to-do list or do this workout and your whole life will fall into place. Right. And it really is all the different aspects of your health, your spiritual health, your wellness, your relationships, and then yourself, your relationship with yourself. You mentioned fitness, which I know is a passion for you with pickleball and just in your life in general. I would love to chat a little bit about really fitness and health and wellness when it comes to physicians, because I can't tell you the amount of times that I've walked into doctors' offices where they're telling me, oh, I need to work out more, I need to do this. And I can basically tell that's not their lifestyle.
Yeah.
So that was something I really admired about you when I got to see you speak in person, is like, oh my gosh, like if I went to your office, I would for sure take your advice because you are glowing, you look like you're in incredible shape. Why is that something that you prioritize? Obviously, you're so busy. And how is that relationship when then you go to give, whether it's clinical, fitness, any type of advice to your patients?
Yes. And I love that question. I'm going to try to say it as professionally as I can, but I don't want to see people who aren't at the peak of what they say to do, right? Like, I don't want a financial advisor who's broke. I don't want a lawyer who has been sued and had multiple, felonies or whatever, right? So if I know that what I desire is for somebody who is the best at what they do for themselves and for their clients or patients, that's what I want. So that's what I want to be, right? And so I don't have a perfect body, but I'm going to exercise it. I'm going to try to feed it well. I'm going to try to prioritize my mental health, or I can't encourage people and be there for everyone else. So I think that's a big part of integrity, as well as my values. I value sharing from a space of expertise because I also do it for myself. And that's what I expect from professionals that I trust in their areas of genius as well. So yeah, I mean, I can't tell you how many times through my training, like all these unhealthy doctors telling people eat healthy, work out. And yes, and I'm thinking to myself, how can you possibly look someone in the face and say that while you are clearly extremely unhealthy and in your own metabolic crisis, right? So it's interesting because when I opened my practice, my second baby was 8 weeks and my oldest was 2. And so it was the biggest that I had ever been. I gained 60 pounds with my second baby. And so I had to do social media and network and tell all the people about this healthy lifestyle primary care practice while I physically looked and felt my unhealthiest postpartum. But it was really nice because I was able to be transparent and I was able to say, hey, we're in this together. I'm working out. I'm trying to get the baby weight off. I'm trying to get back to my healthy goals. I'm training for a half marathon. And those were just the things I was naturally doing. And then, I have people who have followed the journey for a long time and they'll see me in the community now and they're like, oh my gosh, you're so, you're fit, because they saw me like right after I had a baby. And so, yeah, and also being transparent, like seasons of life change and shift, but you still put in the effort.
I love that. And I think on top of it, for me at least, it's not even that I want to have a physician that looks a certain way and it's a vanity metric, especially from a woman to a woman. It's like, oh my gosh, like Dr. Jade is so busy. If she can do this at the same time as having a family and having a baby, if she is able to fit it in, then I should be able to as well.
Yeah, and given grace, because there are seasons where I'm able to more easily put it on the calendar, right? Like I do body pump twice a week at EOS. It's on my calendar as a scheduled appointment, right? But there was a season when I didn't have help in the practice and I was the only person. I was just kind of like more drowning in work. I didn't have the support of a team yet, where it was like, man, I want to work out, but I'm going to have to wake up at 4 a.m. to do that before my kids wake up. And that's the only place I can fit it in because I'm too tired to do it at night. And in that season, I would do that just because it was that important to me. So I'm always in the mindset of not if, but how. So like, okay, it's not if I can work out, but okay, how can I work out in this season? And when my kids were really little and the practice was really busy, I had to do home workouts. I had to do Peloton. We, turned one of our guest bedrooms into a home workout room. Now that my kids are older, we're on more of a school schedule. The practice has support. Now I'm able to go back to my group fitness classes and do pickleball in the community. But I had to say, okay, I'm not just going to not work out in this season because I have babies and my practice is busy. It's like, nope, you're going to do home workouts for now, and it's going to have to be at 4 a.m.
I love that perspective. And it's so true. And it means a lot coming from another busy woman to be able to adjust and fix and fit it in the schedule where you can. I think sometimes we get so in our heads about the way things are meant to be done versus just having that non-negotiable no matter what it looks like, whether it's, hey, I have 10 minutes for a walk or an hour at the gym.
Absolutely. And when I was in my home workout season, I would do like 15-minute Peloton workouts in the morning. And I would literally, sometimes I'd feel bad because I'd be like, man, I wish it could be 30-minute or a 60-minute workout. I'm clicking a 15-minute workout. And I would literally say to myself out loud, Jade, 15 minutes is better than no minutes. And I would just give it my all for that 15 minutes, shower, and then it's time to get the kids together. So those are the same things I share with my patients. Like, okay, well, what can we do right now?
So your practice, at least part of it, NSPIRE, you have a membership-based model, I guess I would call it. And this is new, at least for me. When I heard about it at Take the Lead, I was like, wow, this is interesting. Concierge style practice. Could you share with the audience, one, what it is, and then the difference between your traditional healthcare route?
Yes, absolutely. So first of all, direct primary care is the term of membership medical practice, membership primary care. When we think of primary care is 90% of our healthcare needs. Once insurance companies had kind of corporatized medicine, they flipped it where primary care became just a conveyor belt, a referral center, a place for your doctor to quickly collect a copay and get you to either a specialist where they make more money, a surgical specialty where they make more money if you need surgery, or to the hospital where they make more money, or give a pill where they can make more money. So it really just became a referral center. It was not about being your healthcare home versus what primary care actually is, and how primary care physicians are actually trained is to the full scope of medicine. We do acute care, chronic care, in-office procedures, pap smears. People don't even know we're trained in everything. We rotate with all the specialists. So I don't need to just send you to dermatology. I've trained with dermatologists. I don't need to just send you to ortho unless you need surgery. I've trained in orthopedics. So basically what has happened is a lot of primary care physicians that really want to provide quality primary care and make primary care what it's meant to be, which is your healthcare home where 90% of your healthcare needs are covered in-house. We have moved to a model of healthcare called direct primary care, which is a membership style of primary care. And some people will call it concierge. Concierge was originally made for like the most affluent decades ago. So it was at a very high price point. Direct primary care has basically taken that same access for the everyday professional price point wise. So it's a flat membership like a gym membership, but for primary care, all of your healthcare is covered: text, phone, video, in-office procedures. And it's like the 10% of care that falls outside of the primary care office, we help you to navigate the best, most efficient, most cost-saving places to go for that. So it truly becomes your healthcare home, like the old school thought of like your hometown doctor with technology built in there. And it really has made medicine just so joyful to practice. I know my patients well. I know their names, their kids. When they went on vacation, we're able to catch up. We're able to get in front of things early, help them prevent. I love that as I see my practice mature over the last 4 years, the patients that see me and see our practice, they're healthier and healthier, which is the whole point of me becoming a doctor, not just to push pills or give people a bad report every time I see them, or have to refer them off to surgery specialists, et cetera, because they're just getting sicker. So yeah, I feel like I'm just able to practice medicine the way it should be, like actual relationship in your healthcare home. So that is why we do a membership style of practice. If I took insurance, I would have to follow the insurance company's rules of 5-minute visits, seeing over 30 patients a day, back to back to back, double booking, sometimes triple booking, just in case somebody cancels, because you got to collect those copays to keep your doors and lights on, fighting with the insurance companies to get things covered, people's, MRIs it's just, you spend more time tuggling and tussling with the insurance company than you do actually caring for patients if you take insurance. So unfortunately, that's why over 5,000 primary care doctors across the country are doing a direct primary care practice now. It's been a model that's been open for more than 20 years, and I'm an advocate and teacher in this space, and I absolutely love it.
I'm so grateful that you explained all of that, because I know people are going to be like, what the heck? And how do I get involved? It's interesting because I was a nanny in Florida for a couple years after college, and they actually had a concierge doctor. And I remember being like, what is going on? Like, we could just call her and she'd be like, come in, let's do a strep test.
Yep.
At the time, it was 2 little kids. And the reason that the mom had done that was access, right? Is like, kids get sick. She didn't want to have to go to like another sick part of the doctor's office, all of those different things. And it truly was, the doctor was seeing them grow up and see them all the time and for any need. And it was a really cool and great experience, because from the kids' side of things, they knew who the doctor was. They weren't getting a new doctor every month. They weren't like, okay, I don't know this nurse. They knew who the doctor was. They built a relationship from the child's perspective. And I think as an adult, and especially in Las Vegas, like, gosh, I think I've had a new doctor every year with new insurance, right? Like, to be able to establish a relationship where I'm like, okay, finally this person remembers who I am and what we're working on. I don't have to explain my life story every time I go. Yeah. Those are all small benefits. So when you say, obviously, you don't take insurances, is insurance still necessary for, let's say, if there's prescriptions or if you have to get an MRI? And then what is the health investment for something like this?
Yes, that's a great question. So what we're really doing in this model is using insurance the way it's meant to be used. When you think about car insurance, you don't use your car insurance for gas, for oil changes, for windshield wipes, for any of the maintenance of the vehicle. You use it for a crash, right? And so that's how we're using insurance, health insurance. We aren't using insurance at all, no copays, deductibles, et cetera, for your primary care, 90% of your healthcare needs. But if you need surgery or a hospitalization, that's the time to use your insurance. We also say that you can think of direct primary care like a Costco model, because we are able to go directly to medication manufacturers, directly to lab centers, and directly to imaging centers to get the wholesale rates without insurance markups. Every time your insurance is processed for labs, imaging, or meds, the price will be double, triple, or more the price than if you had the wholesale rate. And actually, you can try it out. If you actually call someplace and use your insurance, as soon as they know you have insurance, they have to process it through insurance. But if you say cash pay, it will be less. But if you are with a direct primary care practice, that's called client bill, and then that price is even less than if you called and said you were cash pay. So we're able to save our members money on labs, imaging, and meds just by being a member of our practice. That saves them thousands. We're able to save them money by doing in-office procedures. They cut their self open, we sew it up. Whatever you need, joint injections, skin tag removal, anything we do in office that we're trained in, that's saving our members thousands, right? But if you need surgery, then we're going to say, let's use your catastrophic plan. Now, what we are educating continuously on is that doesn't mean that the catastrophic plan has to be that traditional PPO, HMO plan. And for most people, that's not the most efficient plan to actually get what they need. So many of our members, we help to customize what they need. Once they join our practice, we say, okay, you've got your primary care, your quality primary care covered. That's 90% of your healthcare needs. Let's talk about the other aspects and customize that. Based on their health history, we'll say, oh, wow, you're really healthy. You would benefit from a HSA, a health savings account, paired with a high deductible health plan, which lowers that monthly premium, but pays for the big ticket surgeries, hospitalizations. And you can use those HSA dollars to pay for your NSPIRE Primary Care membership. And that's a pre-tax way to do it. So there's tax savings. And we also work with employers. Many Las Vegas businesses will offer us as their healthcare benefit. They will offer their employees a HSA high deductible health plan option. All their employees use us for their health care. And the business owner contributes to their employees' HSA, and that is now a tax write-off for the business. So we're saving businesses money too. So there's efficient ways to do it. There's also something to look into called health shares. I'm not sure if you've heard of a health share. We partner with health shares, where that is another option for people to look at if a direct primary care practice like NSPIRE paired with a health share is the best and most efficient way for them to get the catastrophic needs covered. So it's really more in 2026, gone are the days where you just need to just go to a broker and say, give me the PPO. Because if you do that without actually thinking about the pieces behind what they put on the paper, you will be disappointed with what is actually covered when you go to take out that insurance card. Because the prices are higher, but the care built within that is less and less and less each year. I tell everybody, like, it's great to go to an all-inclusive resort. That's fabulous. But if you go to a janky all-inclusive resort, it ruins your whole vacation. And PPO plans have kind of become that janky all-inclusive resort. So it's really like customizing your European trip. I need to know what train I need to take. I need to pick my own hotel. I need to pick my own amenities to actually get the best vacation. So same mindset. It's just a mindset shift, but it's such an important part of our health. I mean, health is like the key asset, where we can't just take what's being given to us and just saying, well, price is going up, care sucks, but this is all we got. Not true anymore.
Wow. My mind is blown. I have 1,000,005 questions for you because for me, I'm asthmatic. So like I obviously always need medication. And I have been through the gamut of insurance companies, doctors, how much do things cost, proof, like you're worked around that at some point it exhausts you so much that you're like, I'll just pay whatever. I just don't want to be on the call. I mean, literally a couple months ago, we were trying to get insurance, my mom and I, and suddenly people don't work there. So you're dealing with an AI agent and then you're just yelling at the phone. And it's like, people are not aware that things like this exist, including myself. So what do? We go to these different brokers, portals to get insurance to make sure that we have the coverage we need, mostly for probably people like me that have a medical condition that they need their meds. And I think for me, at least, it's always felt so frustrating because I'm extremely healthy. My blood work is always perfect, but I have this condition that I've had since I was little, right? I have to treat. So in that case, for someone who is, let's just use me as an example, I'm healthy, where would we go from there regarding insurance and then the medications?
Yeah, that's great because a lot of people that have a hard time wrapping their mind around direct primary care is people who are healthy, right? They're like, well, why would I pay a monthly membership, although they're paying monthly for insurance? Why would I pay a monthly membership if I'm overall healthy? But it is the access, the prevention, and the ease to actually get things and to get it in a way where it's the most efficient. And it's kind of like having the connect, right? So for you, for example, I would want to compare, we have discounted pharmacy coupons that we always have our patients compare versus using their insurance copay. So I'm always like, let's check and see if using your insurance actually is saving you compared to the discount pharmacy coupons. Most of the time, it's the pharmacy discount coupons. So just like that small nuance where they're like, oh my gosh, I've been paying a $20 copay on my inhaler and it's actually an $8 coupon available. I had no idea. So just those little things. Or when our members that have asthma, first thing I'm going to tell them is, do you have a nebulizer at home? And they're like, well, no. And I'm like, well, that's step one. All of my members that have asthma need a nebulizer at home because the moment you start feeling flared, that's a text message to me and the team, and we're immediately sending nebulizer solution to the pharmacy a block away from you so you can begin your breathing treatment versus saying, let me look at the calendar, let me see when we can get you in, go to the urgent care, okay, sit in my waiting room while you can't breathe and drive across town while you can't breathe so we can try to collect your copay to do an in-office. Like none of that makes sense, right? So it's like, let's care for you the way that's actually going to be the most efficient to what you need. So just little things like that where they're like, I've never been to a doctor where they told me like, oh, first step, get a nebulizer machine for home. Like, what are we talking about?
Well, it's even the management of it. Like you mentioned, obviously getting a pap smear or the dermatologist. I mean, every year I switch doctors. Every year I have to remember which doctor I have to go to for which versus coming to one place where it has everything. All the results are being stored in the same place.
Yes.
You mentioned that you're going virtual. So if you have someone, let's say in Nevada, that is using your practice and maybe they're out of state for something, do they still have access to you if something were to come up?
Absolutely. Absolutely. Yeah, as long as they're in the United States. Well, let me break it down. So we care for a lot of pilots and flight attendants. That's been a big industry that we care for because they're, a travel profession. And they've found so much benefit to having us because if anything comes up, regardless of where they're on a layover or whatever, we're able to care for them. So I'll have some of our flight attendants say, hey, I'm in Texas for a layover. I just got sick on this flight. Can you send a prescription, for my upper respiratory infection? This is the address to the pharmacy in Texas. That's a text message. We send it away, and they have it. They're able to pick it up right then and there. So yes, anywhere in the U.S. For example, now we're licensed in Nevada. If I establish care with them in Nevada, they can be anywhere else in the United States and we can still care for them and treat and send prescriptions to the pharmacy. That's going to be expanding soon where they don't have to necessarily establish in Nevada because we're getting additional licenses. We can, establish wherever they are as long as I'm licensed in that state. So that's the expansion piece. So yes, the only nuance to that is if they're out of the country. For example, we had a member last month who got a little under the weather. She was in Africa. United States-based physicians can't send things out of the country. But she emailed me and we were able to talk through the symptoms. I was able to help her navigate, like, do you need to go be seen by a doctor in Africa or not? In that case, she did need to go. So she got seen. As soon as she got back, she brought her records from Africa to the office. We went through them and then we continued on. I've had another patient who was in India and she emailed me and her symptoms didn't need to be seen by a doctor in India. So we were like, oh no, you're good. Do this, do that, grab this over the counter. And as soon as you get back, let's follow up and we'll move from there. I try to ask people, have you found a healthcare home? Because asking the question that way helps it to click. It's not, do you have an insurance card? It's, do you have a healthcare home? And if the answer is no, that's a problem. And so we are the healthcare home for our members. And I don't have to explain much more.
Yeah, because people are probably always going to say, no, I have no idea what that means.
Yes.
So let's give people a little context. Are there different tiers to the different memberships? Or let's say for me, I spend about $500 a month on my insurance, probably on top of everything else that I'm paying with it. Is that transition to then coming into your office comparable budget-wise?
Yeah, that's a good question. So we have 3 tiers in our office. We have a virtual only plan. We have our concierge plan, which includes in-office management as well. And then we have a specialty tier if people need medical weight loss, hormone management, or longevity peptide care. So those are our specialty tiers. So first thing to figure out is, what kind of care do you need for your primary care piece? Are you someone who only really needs to be seen virtual versus in-office and pap smears versus specialty care with weight loss, hormone, and longevity peptide care? So once we figure out which primary care piece is best for them, that's when we're able to have the conversation. And this is after we get their history and find out their health needs, their medication history, et cetera, on what's going to be the smartest and most efficient catastrophic plan to pair with that. And for example, if someone has had or has breast cancer and they're going through chemo and radiation and need to see a lot of specialists, those are high ticket things where a more traditional insurance plan is going to be beneficial just because of the price of the chemo medication and the visits to a specialist and hospitalization, surgeries, etc. But if we have someone that's healthier, or they're trying to have a baby, or they're out of the baby having season and they just need colonoscopies and things like that, then we're going to talk about health shares, HSAs with high deductible plans, how to actually make that catastrophic piece make sense both financially and get what they need out of their healthcare in their stage of life. So I think it just really goes away from thinking of anything as cookie cutter, just like how medicine should be. Like, everyone who comes in my office with asthma is not going to get the same management plan because everyone's different and it flares up and shows up for different people. Some people are seasonal, some people are everyday severe. So it's the same approach to health insurance, health care, primary care. It should be customized.
I love that. I love that you're approaching it that way. And I feel like it would probably make each patient feel very seen.
Yeah.
Aside from this time you're spending with each of them. During this process of building your practice, what has been your favorite part in the last 4 years?
I haven't been asked that question. I love that question. Seeing the vision of people's transformations and their experience of healthcare changing. Seeing people come in so resistant. So many people have had negative experiences in the doctor's office or with healthcare, not being heard or listened to, not being believed, feeling judged, feeling humiliated, just feeling frustrated, and them to be at the point where, we're early in the direct primary care movement in the sense of it's a 20-year movement. And so them being brave enough to try something different hesitantly and then be pleasantly surprised and be like, wow, I'm never going back. That has been like, wow, I believed in my heart this would be a practice that would serve well and transform health and make a difference. But to actually see it realized and hear the stories and see the Google reviews and see people in the community and they look so much healthier, that's what gives me joy. And that's what keeps me going on the hard days where it's like, it's not about you.
I mean, that will trickle down to future generations, right? The lifestyle changes, the conversations that are happening in your office impact even more than just the person sitting in front of you.
Yeah, that's the best part.
Yes. So we've talked a lot today about healthcare, about how you and your husband are personally changing the industry. What is something that you wish people questioned more when they walk into a medical office?
I would wish that people would ask themselves why and then actually do something about that. So for example, if they go to make a phone call for an appointment and it's a hassle to get somebody on the phone just to make an appointment. Okay, well, why is that? Okay, it's because there's 3,000 people trying to make an appointment with that same doctor that the insurance company assigned. And what are you going to do about that? Are you going to keep sitting in that? Or are you going to explore ways to not experience that? If you're in the doctor's office, when you finally get that appointment you've been waiting months for, and they have you sitting there for an hour and refilling out the same form again. And then you get pulled back and you wait some more, and then the doctor rushes in and out. And now you had to take off a whole work day and you're mad about it. Well, are you going to do something about that? Like, are you going to say, man, why is it like this? Well, it's because they put 30 people on the schedule for 20 slots. And you're waiting and the doctor's behind because that's what they have to do to keep the lights on if they're taking insurance. Are you going to stay in that and say, well, my job gives me insurance, or this is what I have, this is all I can take? Or are you going to explore if there's a way to have a better care? What I love is that as people start to learn about this, I had a lady who was following me on social media, learning about what I did. She paid attention and saw that we do corporate partnerships with businesses in the town. She was an office manager for a local business, and she told the owner of the company, hey, we want you to pay for this for our healthcare benefit. And then we did a meeting, and now we are the healthcare benefit for the whole company. But it took her paying attention, asking the question, and making the connection. And now she and her colleagues have the benefit that they actually need and deserve. So instead of her just saying, oh, our employer just gives us, Blue Cross Blue Shield, that's all we have to take, she thought about it and said, this doesn't work well. I don't like this. And I heard about something. Let's at least explore it. The CEO was open enough and actually cared about their team enough to say, well, I'm willing to hear about it. And now we're not only saving their company money, but now their employees are happy and healthier, which is also leading to the business being healthier. So not just sitting in this is what I'm being given and this is what I'm stuck with. That mindset will keep us sick and frustrated.
The curiosity piece, I think, is huge. And if you don't go looking sometimes for businesses like yourself, you might not find it. But if you open up your mind and get to researching, then you have the resources to find something new and try it.
Yes.
Well, I can't thank you enough for coming on the In Between podcast. I could seriously talk to you all day and ask you all the questions. I find it so inspiring and so interesting, your passions, because as someone who's been frustrated by it many times, you're giving me all sorts of a new perspective, which I beyond appreciate. I would love for you to share with the audience, if someone's experiencing an in-between moment right now, what advice you would give them.
I would give them the advice to keep going. It may sound cliche, but us stopping is the thing that holds us back. There's been so many seasons where I've wanted to quit in the hard, but I kept going, even when it was hard. And those are the pieces. Like, people want to talk to me now only because I've survived a lot of hard seasons. If everything was just easy, or if I quit early on, there wouldn't be a reason to be interviewing me right now. But just know that the people you see that look successful or look like they have it all together, they survived a lot of hard seasons you didn't see. And so it really takes whatever that is for you. For me, it's prayer and family and lifestyle and surrounding myself with positive people, but whatever it takes to keep going so that you can operate in your calling and have joy in life and joy in what you're doing and serve people in your zone of genius where it doesn't even feel like work. Keep going.
I love that answer, and I totally agree with you. None of us would be sitting here if it weren't for all those in-betweens. We just decided to keep going.
Yep, absolutely.
Well, thank you so much, Dr. Jade. Thanks for hanging out with the In Between podcast, and we'll catch you next time.
Thank you for having me.
Thank you so much for hanging out with me today. I hope this conversation gave you exactly what you needed to hear, whether that's permission to slow down, motivation to keep going, or just a reminder that you're not alone in the in-between moments. Now, if you're a female founder or a value-driven brand looking to build meaningful connections on social media, I'd love to work with you. At Cassidy Lynn Social, we help brands express their authentic voice through strategy-driven social media management. Head to CassidyLynnSocial.com to learn more about how we can work together. And if you've loved this episode, please share it with someone who needs to hear it. Screenshot it and tag me on Instagram at Cassidy Lynn Social. And if you're going through your own in-between moment right now, keep showing up. The growth is happening even when you can't see it. I'll see you next week for another in-between conversation.